The three big challenges of the U.S. healthcare system are cost, quality, and access. The greatest of the three is the problem of health expenditures. $1 trillion is a lot of money, and 16% of gross domestic product is a lot of money. The real problem is when we spend 16% of our gross domestic product on health care, there's little left over for education and social problems. And that expenditure is due to grow in the next 10 years. Even among the world's most developed countries, the U.S. invests 45% more than the next highest country. The fact that the U.S. spends so much on medical care and so little on public health puts enormous pressures on public health managers to manage those scarce resources, to secure additional funds to make increasing demands, and to hold on to the tremendous gains that public health has achieved in terms of community health and population health. According to the World Health Organization, the United States has the highest rate of health care expenditures in the world, but only the 72nd best outcome. And in this case, outcome has to do with disability adjusted life years. It's a concept related to living with a health disability and infant mortality. Those are the two measures that the World Health Organization used to measure the quality of the health system within a country. So we spend far more than other countries, but yet we have only the 72nd best outcome. And this, if you need any evidence to show that spending on medical care doesn't improve health, I don't know what else to tell you. So, even though we're number one in expenditures for health care and 72nd in health outcomes, that's not the whole picture. This slide shows the 10 leading causes of death in the U.S. So, what do you notice about these 10 leading causes of death? Well, when you look at these more closely, these are all things that are A, preventable, and B, they're closely related to persons' behaviors. So thinking back to the 10 leading causes of death, these are all causes of death that could be prevented, and the underlying causes, that is the contributing cause of that death, is most likely a behavior. So what are those types of behaviors that contribute or lead to those 10 leading causes of death? So let's take the first one, the greatest underlying cause of death, tobacco use. What does tobacco use cause? Well, tobacco use may cause cancer, heart disease, stroke, diabetes. What about heart disease? What causes heart disease? Physical activity or inactivity, lack of physical activity, poor nutrition, use of tobacco. The underlying cause of physical inactivity contributes to multiple chronic diseases which are leading causes of death. The other thing to note about these leading underlying causes of death is they're all modifiable, they're all preventable, they're all behaviors. So they're things that we can not do and therefore avoid not only those high expenditures but also those unnecessary deaths. So think about these leading underlying causes of death as very important to focus on. Second thing to remember about them, other than their behaviors, the medical care system doesn't really deal well with prevention of these underlying causes of death. So we need to focus elsewhere to prevent these underlying causes of death. This slide is a stream. Downstream is a big river running into an ocean, and think about that as the 10 leading causes of death: mortality, we really have focused in this country on those 10 leading causes of death and the treatment costs associated with those 10 leading causes of death. To really make a difference, we need to move back upstream to the midstream area, which is the 10 underlying causes of death, which is behavior. Now, is it enough to tell people don't smoke, eat right, be physically active, avoid alcohol, wear your seat belts, don't play around with firearms? Does that really work? So is it enough to stay at the midstream, or do we, thinking about Derek, thinking about the community in which Stickman lives, right near the cliff, near the edge of the cliff, is it acceptable to stop midstream, or do we need to go further upstream into the social environment? 80% of our expenditures for health care in the U.S. are for chronic conditions, yet we're focusing really in the wrong place and the wrong types of diseases. So physicians are trained to deal with communicable diseases and conditions that 100 years ago were killing people. To really make a difference in terms of the burden of disease in this country, we need to focus on some other underlying causes and conditions, not the least of which are major causes of death within this country, which are injury and violence and non-communicable diseases such as chronic diseases that are related to behavior and not infectious agents. The burden of disease from firearms, suicide, homicide, motor vehicle crashes, unintentional injuries is enormous within this country, and that burden is only marginally affected by providing medical care. This slide is a model of our social environment and its impact on behavior. This is called an ecological model. It's the underlying model for public health. It's a general systems model, and it depicts the impact of the social environment on the individual. There are 4 major categories that determine our health, and it's debatable about the contribution of each of these 4 categories, but what's not debatable is that these 4 categories interact with one another and are the most powerful influences on our health. This slide depicts Bloom's paradigm. See page 4 in your text. It's important to focus on the size of each of these 4 force fields. Think about them in terms of the relative impact of each of these. And again, as I said earlier, these 4 areas, there's been a lot of debate about the relative contribution. What we know now is that certainly the social environment plays a major impact on our health. Also, we know that lifestyle and behavior are very important. Think midstream, think underlying causes. What is probably most debatable here is the contribution of medical care. Think back to those leading underlying causes. Which of those underlying causes that we need to focus on are really things that providing medical care would have much impact on? And really, when you think about it, they have very little impact on our behavior, which are really the underlying causes of mortality and morbidity in this country. Heredity and genetics are areas of research where we're just beginning to understand the contribution. The way I would look at this slide is that all 4 of these factors work in combination. It's very difficult to disentangle the contribution of any one of these factors. Sir Theodore Marmot is thought of as the father or the originator of the concept of the social determinants. So what research did Marmot do? Well, Marmot studied British civil servants. Now, a type of civil servant in Great Britain are the employees that drive the double-decker buses. So what employees are there? There's a driver and a conductor. So Marmot was studying the prevalence of heart disease among these two classes of employees that drive and operate double-decker buses, the driver and the conductor. Among those two classes, which group do you think would have a higher prevalence of heart disease? Now, while you're thinking, and say it out loud so I can hear it if I were there in the room with you. So which do you think would have the higher prevalence? The driver who's sedentary, sitting all day, trying to negotiate traffic, the stress of traffic, or the conductor who's up and down the stairs of the double-decker bus? So I think I heard your answer, and I think you probably said, I'm guessing, that you probably said the driver has the higher prevalence. Well, if you said the driver, you were wrong. And why were you wrong? Well, think about what we just talked about in terms of the leading causes of death and leading underlying causes of death, and the importance of the social environment. So what social environment are we talking about? Talking about the social environment. Think Derek in Hot Spotters. Think stick man, the first stick man living in the community right up against the edge of the cliff. Those social environments are more stressful, and that stress, as Marmot found, gets translated into biological terms. And so by far the higher prevalence of heart disease was among the conductors and not the drivers, because in England the drivers are in a much higher social class. So other than social class, you might think of income and education in our country are indicators of social class, but it's really at the core the neighborhoods in which we live, the environments in which we live, the advantages of those environments. Think back to Derek and think back to Stickman. Health equates to wealth, and wealth equates to health. The inverse is persons living in low-income neighborhoods are living in very stressful environments. That gets translated biologically into factors that cause heart disease, stroke, and other chronic conditions. So, saying this in a much abbreviated fashion, the social determinants of health are mortality, morbidity, and well-being are linked to social structure and social class. What are the determinants of health? Income, social factors, social support networks, education, employment, working and living conditions. Again, think of Derek and think of Stickman, the physical environment in which Derek lived, social environment, biology, all of those four major factors of determinants, genetic endowment, all of those go together and they interact in ways that oftentimes we don't understand. Our personal health practices, our behavior, our ability to cope and adjust to changes within the environment, the impact of the stressful environment and poverty on early child development, the presence or absence or access to health services, gender and cultural factors, racism, all of those are factors within our environment that impact upon our health. And those things interact in very complex ways. The concept of social gradient is very important, and that is that health status improves at each step up the income and social hierarchy. And this effect occurs all across the socioeconomic spectrum. And this is underlying related to the degree of control that people have over their life circumstances and their ability to act as powerful people within their environment. Again, think of the conductors on the buses, think of Derek, and think of Stickman, people who didn't have power in our culture, in our economy, and in our society. The social gradient also affects other factors, not just health. You see on this slide a list of conditions, social problems that also respond and are indicators of the social gradient. Again, low socioeconomic status, high problems. This slide also depicts the social gradient, and it is the subject of some extensive research that's done by the CDC on the Behavioral Risk Factor Surveillance System. It's a set of telephone interview questions, about 131 questions to be exact. And this particular question, is about overall health status and shows relationship of educational level and health status. And you can see very clearly from this slide that those persons of excellent health are likely to be higher educated, and conversely, those persons with poor health are likely to be high school or less than high school educated. This slide gives us the numbers behind the previous slide. Focus on the excellent health and look at that gradient there. Look at it numerically over hundreds of thousands of interviews across the U.S. You can see the dramatic improvement in health as we go from less than high school education to college graduate. And even though we don't have the confidence intervals depicted here, I can tell you there is no overlap here. So this is very highly statistically significant. This gradient is real, and it exists for every one of those 131 questions. Likewise, if you would focus on the poor, you see the opposite effect. Income and education are proxies for social class, and this slide depicts another question in the demographic section of BRFSS, and again you see the social gradient here focusing on those with excellent health. That is that those with excellent health tend to have higher incomes, those with poor health lower incomes. So to summarize the effect of the social gradient, you can see that socioeconomic status is a powerful and consistent predictor of rates of disease and deaths in populations. One of your readings is on the Framework for Public Health Impact by Dr. Thomas Frieden, who happens to be the director of CDC. And this is Dr. Frieden's model. And let me talk you through this model because it's not immediately apparent what it means. As you go down the pyramid, you go to more impactful interventions. The higher levels of the pyramid are less impactful. Now, in our current society and in public health, we spend a lot of attention on counseling and education. We have a whole department here at Arnold School of Public Health on health behavior, health promotion, and education. Well, that's one individual at a time, and relative to the cost, we don't get a lot of impact from that. So how do we get impact? Well, we get impact by moving down the pyramid. So clinical interventions, medical care is very impactful in some conditions. Think about the clinical preventive services in public health. But again, they still tend to be at individual levels. There are the next level down, long-lasting protective interventions. If we do something one time, it fixes the problem. Think immunizations here. More impactful and certainly more population health relevant. So I want us to focus primarily on the last two levels here. This is where we get the real bang for our buck, so to speak. In terms of the next to the last level, changing the context to make an individual's default decisions healthy. So what does that mean? Well, think about tobacco control and think about secondhand smoke. One of the leading underlying causes of death, if not the leading cause, is tobacco. And the problem of secondhand smoke is almost as dangerous. In other words, being in the room with someone who's smoking is almost as dangerous as smoking itself. So how could we change that? Well, by local ordinances to prohibit smoking in restaurants and bars. That would make it a default decision. So you go into a restaurant or bar, you don't have to worry about whether people are smoking or not, or even whether you're going to smoke or not. You're not. The same thing could be said of wearing seat belts, wearing motorcycle helmets, other types of interventions like that, policy decisions. Now those are very impactful. Problem lies is that in the U.S. we don't like people to tell us how to behave, or in this case how not to behave. And even though it's not effective to tell people not to behave, it's more effective to create laws and ordinances that make the default decision the healthy decision. Those are very politically charged issues, and so as you go down the pyramid, you spend more political capital to get those measures passed. But nevertheless, you might agree after thinking about this lecture, this is where we need to be going in our public health system. Finally, to have the most impact, we need to work on socioeconomic factors. Again, think Derek, think Stickman, think about the social determinants of health, and think about the social gradient. And if we could, rather than spending the 16 to 20% of our gross domestic product on health care, if we could spend that on social factors, on education, employment, what an impact that would have. This is a powerful example of impacting the social environment and also the environment through creating a default situation where the behavior is healthy. And in this case, the city of Pueblo, Colorado passed a ban on use of tobacco in public places. And within 18 months of passing that ban, 27% reduction in heart attacks. All right, this is the message of this lecture. So think about Derek, think about Stickman, think about the social gradient, and think about the challenges that the U.S. healthcare system faces in cost, access, and quality. And remember that an individual's chances of getting sick are not really related to medical care. It's a complex interaction of many other factors, but the central factor going way upstream is the social environment.
There's a little black spot on the sun.